Hi, this is Jane Morton, and this is section 3 of our Welcome to Medicare series. We are Western Montana Area 6 Agency on Aging. We serve Lake Lincoln, Mineral, and Sanders counties. We're located at 110 Main Suite 5, Polson, Montana, 59860. Our local number is 883-7284, or if you're outside of our calling area, it's 1-800-551-3191. I am a SHIP counselor. The Montana State Health Insurance Assistance Program consists of people who are trained and certified by the state of Montana to counsel Medicare beneficiaries with whatever issues they have. We have 4 SHIP counselors in the Polson office. We also have SHIP counselors who live in Lincoln, Mineral, and Sanders counties and can help you. You can call our office and we'll put you in touch with them. You can also call Social Security for Medicare information. We recommend you call one of the local offices, either Missoula or Kalispell, and their numbers are here. In sections 1 and 2 of our series, I talked mostly about original Medicare. Getting Part A and Part B, adding drug coverage, and then if you want, adding a Medigap plan. There is another alternative way to get your Medicare. Now see this word "or" up here? I'm trying really hard to put my hand here to help you divide. When I'm working with people in the office, I have this little chart and I actually fold it in half so that they can only look at one half at a time, because you only do one thing or the other. So we've talked about original Medicare. Now we're going to talk about the Medicare Advantage option. Just keep in mind, you don't go back and forth. You either do all of this or all of this. Okay, a Medicare Advantage plan, you're still part of Medicare. You still have your Part A and your Part B. You still have all the rights and protections of Medicare. However, your Medicare is managed by the insurance company, whatever Medicare Advantage plan you choose. Medicare sends them a chunk of money for your benefits, and they're the ones that pay all your bills. All your bills go through them. They're the only ones that can pay it. If you're on Medicare Advantage, you can't send bills to Medicare. You send bills to your insurance company. They have their own premium structure, their own copay structure, and the premium varies. We'll look at some of those options in just a minute. You still have to pay your Part B because you still get Medicare Part B. It's just that it's all being managed through your Medicare Advantage plan. So this is just the same thing that I just said on the chart. The Advantage plans combine Parts A, B, and possibly prescriptions, Part D, in a private insurance policy that's approved by Medicare. It's not just approved by Medicare, they actually have a contract with Medicare, so they have to do what Medicare says. If you have a problem with them, you can go to Medicare and Medicare will address it for you. You still pay your Part B premium. Your health care coverage is equivalent to original A and B, but it might be structured a little differently. And you're not allowed to purchase a supplemental Medicare insurance, a Medigap plan. You don't have Advantage and a Medigap. Either go one way or the other. Medicare Advantage plans have a structured copay system with deductibles. They may have additional benefits like vision, dental, and hearing. Those benefits are somewhat limited. They usually cover more in the neighborhood of yearly checkups and exams and x-rays. But they are a little bit of additional benefit that you don't get with original Medicare. Most of the Medicare Advantage plans have a monthly premium, and then some of them are PPOs, or Preferred Provider Organizations. That means they will pay in and outside of their network. They prefer that you go in network, and it's cheaper for you to go in network because they'll pay more, but if you go out of their network, they still pay some. Some plans are HMO, or Health Maintenance Organizations, and they pretty much only pay within their network. If you go outside of their network, they don't pay anything. It all comes out of your pocket. Now this is just a copy of the chart we make up every year. This one is for the plans that are available in Lake County. You can see there are 2 Blue Cross plans and 2 Humana plans available. And we'll talk about these others in a minute. The main ones are here. These first 3 are PPOs. They'll pay in network or out of network. That's why they show 2 amounts. In network is usually a dollar amount. Out of network is usually a percentage, and you can see that out of network is going to be 50% almost all the time. So let's talk about the PPOs first. This first one here, the Blue Cross Blue Shield Classic Plan, is $40 a month, and there is no deductible in the health portion. There is a maximum out of pocket. Now, maximum out of pocket means that the most you could be liable for. If you had a catastrophe, car wreck, or really expensive surgery, and your hospital, your doctor bills were hundreds of thousands of dollars, the amount you're liable for is limited. In this Blue Cross Classic, if you stay in their network, the maximum out of pocket is $6,700. So if you had a terrible car wreck and you owed $200,000 to the hospital, you would only have to pay $6,700, and they would pay everything after that. That's if you stay in network. If you go out of their network, you still have a maximum out of pocket, but it's $10,000 before they start to pay everything. Okay, then there are co-pays for various services, like a visit with your primary doctor. You're going to pay $15 in network. If you go to an out-of-network doctor, you're going to pay 50%. If you go to a specialist, $45. And we'll just skip down here. If you have a Medicare Advantage plan and you're put in the hospital, if you go to an in-network hospital, for days 1 through 5, you have a copay of $360. If you're there longer than 5 days, for days 6 through day 90, you don't pay anything. That's if you stay in network. If you go to an out-of-network hospital, you pay 50% of the hospital bill. All of these plans have drug coverage, and this is just a thumbnail sketch of what the different tiers of prescriptions cost, but we can use the Plan Finder tool to see exactly what your copays would be under this plan. Also, they show deductibles here. They waive the deductible for tiers 1, 2, and 3. The deductible only applies to tier 4 or to tier 5. Those are pretty expensive meds. Otherwise, you probably won't have to pay a deductible. They have an optimum plan. The monthly premium is higher. Generally, everything else is lower. The maximum out of pocket is lower. The co-pays are lower. In network, however, out of network, everything's still 50%. Humana's PPO plan is $68 a month. No deductible. The co-pays otherwise are real comparable with the lower priced classic plan. This Humana Choice plan, well, all of these plans have some additional benefits. And I was going to hold that up and show you, but I can't find it. Okay. They all have some additional benefits, and we can mail you out a copy of this plus pages that detail their additional benefits. This Humana Gold Plus plan is an HMO plan, meaning they only pay in the network. They're $44 a month. You can see that their co-pays are pretty good. And they do have drug coverage. You just have to remember, if you go outside of the Humana Advantage network, which is local, for all of these plans, the Advantage network is pretty much from Missoula to Kalispell, and most everybody in between. If you go outside of that network, then you have to pay the higher price. If you have an HMO, if you go outside of that network, it's all going to come out of your pocket. This Humana Choice plan doesn't have any drug coverage, and you can't add drug coverage to it. So it's only for people that have some other drug coverage, like VA drug coverage or Indian Health Service drug coverage. It does have a zero premium, but it's only good for you if you have some other drug coverage. This plan is a Medicare savings account plan, and the company is called Lasso. If you're interested in this, we can give you the contact information. We can't sign you up for this. You have to go to them. I'll just real quickly say that the way it works is they take that chunk of money and they put some of it in a Medicare savings account for you. And you can use that Medicare savings account to pay your doctor bills. However, their deductible is $7,400. So if you spend everything in your Medicare savings account that they put in there, you still have to spend about $4,000 before the Lasso company will pay anything. Once you have met this deductible, they pay everything. You don't have any co-pays. But it doesn't have drug coverage, so you have to get a prescription drug plan on top of that. But if you're interested, we can sure send you information about that. As far as what's new, they seem to add more covered preventative services every year. The newest things are now they cover screening and counseling for depression or alcohol misuse or cardiovascular disease or obesity. Another thing that's pretty new is the donut hole is pretty much closed now. Used to be if you had really expensive meds, you would hit a point in the year where they would say you fell in the donut hole or you're in the coverage gap, and then you would have to start paying full price for your meds, which was pretty awful for a lot of people. Gradually they've been closing the donut hole until in 2020 drug companies pretty much have to pay what the beneficiaries used to have to pay when the donut hole hits. Another thing that's probably the newest for all of us is the coronavirus. They didn't have any coverage for coronavirus because it didn't really exist until 2020. And so they had to rewrite some laws to add coverage. So now Medicare covers lab tests for COVID-19, antibody tests for COVID-19. If you're hospitalized for COVID-19, and even if you would normally be discharged, but they're going to keep you longer to keep you under quarantine, it's all covered by Medicare. Right now there's no vaccine for COVID-19, but it's already in the law that if a vaccine becomes available, Medicare will cover that for you. If you have a Medicare Advantage plan instead of original Medicare, you have the same benefits. You just need to call your Medicare Advantage plan. They may handle it just a little bit differently, but you still have the same coverage. During this coronavirus pandemic, the scammers are working overtime to try and steal money from whoever they can. And of course Medicare is one they want to steal money from because it has a lot of money. So this is just a reminder to guard your Medicare card like a credit card. Don't give your number to anybody. Don't give anybody your Medicare card unless it's a provider or you know who you're dealing with. Check your Medicare claims summary, and if someone calls asking for your Medicare number, just hang up on them. Don't be polite. Again, here's another reminder, Medicare does not contact you by phone for any reason. We tell people that over and over, but I have to tell you one thing. When you first sign up for Medicare, if you sign up online, they often call just to confirm some things. That would be the only time. The Senior Medicare Patrol focuses on teaching people about fraud and also helping people if they've been the victim of an error or fraud. You can call us if you have a problem with fraud or a problem with a bill that you don't think is right. If we can't solve it, we can go to the state Senior Medicare Patrol, and they'll put some specialists on it, and they can usually untangle a lot of stuff. And I like to say they have a lot more juice than we do, because there are things that I've beat my head against the wall trying to get changed, and when I turn it over to them, it gets taken care of. So call us if you have a problem. Here are some more reminders about Medicare fraud. You should always check your Medicare statements, or if you're on Medicare Advantage, they'll send you an explanation of benefits like you get from your insurance company right now. A lot of people think, well, as long as it shows they paid everything, I don't care about all the details. But you should always look it over, because one of the things scammers like to do is, if they find a way to charge your Medicare number and get some money, it will show up on your bill as if you got the service. And later, if you need that service or you need that equipment, Medicare may refuse you because their records show they already paid for that for you. So you want to check your benefits, not your statements, not just to protect Medicare, but to protect yourself also. And then, of course, don't give any personal information over the phone unless you initiated the call and you know who you're dealing with. For example, if you call us for help with a Medicare issue, we're going to ask you for your Medicare number. But if someone just calls you on the phone and claims to be from wherever, and they want banking information or Medicare information or Social Security information, it's baloney. Another thing that they like to fake is, oh, we can get you a plastic Medicare card if you just send us X amount of dollars. There's no charge for Medicare cards. Medicare does not call you for information, and Medicare is not issuing plastic cards. Scammers try everything, anything and everything to pretend they're from Medicare, to pretend they're from Social Security, to pretend they're from your bank. I had one the other day that almost got me. They were pretending to be from Amazon. Medicare will not call you. They certainly won't call and ask for your Medicare number because they're Medicare, they have it. So if you have additional questions about anything related to Medicare, again, call us and we can put you in touch with a SHIP counselor to help you answer your question or solve your problem. Or you can call the Social Security offices. There are also some online resources listed here. You can do a lot of stuff at ssa.gov. You can get a lot of information at medicare.gov and at any of these other websites. If you have Big Sky RX questions, you can call them. They don't have a website. And that's the end. Thanks for watching our 3-part series. We sure hope you found our 3-part series on Welcome to Medicare helpful. And please be sure to like us on Facebook or subscribe.